I have worked in hospitals and healthcare a very long time, and I'm going to share with you a few things about hospitals, nurses, doctors, things that will probably shock the hell out of you. The first one, when you go to a hospital, if something ever goes wrong and they have to call a code on you, meaning they have to get someone to come in and start CPR and all the things, just know that 9 times out of 10, the doctor is not who's going to save your life. It is the nurses. The nurses run codes. The nurses saves lives. It is not the doctors. Actually, 9 times out of 10, the doctor is the very last one to even get to a code. It is the nurses who run the codes. It is the nurses who save your life, period. Number 2, nurses very, very rarely get a lunch break that is uninterrupted. It just doesn't happen. They don't get 2 15-minute breaks where someone just gives them 15 minutes to decompress. It doesn't happen. Nurses, every single time they sit down for their lunch break, 9 times out of 10, somebody needs something. Someone is calling their phone. Someone is looking for them. Someone needs something as soon as they sit down. It is very, very, very rare that your nurse gets an uninterrupted break or lunch. And so I'm not sure why people are so hard on nurses, because they are truly overworked and stressed. Number 3, nurses are not allowed to tell you your test results. Even if they know them, they cannot give them to you. And it is not that your nurse is incompetent. Your nurse knows very well what is going on. A lot of times more than the doctor. But they're not allowed to tell you. That is outside of their scope of practice. The doctor is the one who has to tell you, even if the nurse knows. She is not allowed to disclose certain information to you. Your nurse is not incompetent. She knows, she just cannot tell you. And no matter how many times you ask, she's going to have to tell you that you have to talk to the doctor. But I guarantee you, nurses probably know more than your doctor most of the time. Number 4, at every hospital in the world, and I don't care what people say, there are at least 4 or 5 doctors that every staff member in that hospital would not use, even if their damn leg was falling off. Yeah, there are some doctors that are just horrible, and no matter what was going on, they would not let that doctor touch them with a 10-foot pole. But most hospitals have a policy that staff members are not allowed to disclose that information to patients. But there are, in every hospital, doctors that are straight trash, that are garbage, that those staff members, especially nurses, would not let them touch, even if they were the last doctor available, because they are just that bad. So what I strongly suggest is, honey, do your research. Go to Google, word of mouth. It gets around quick. Before you decide to let any doctor fully touch you, operate on you, do test on you, do your research, because it is serious. Number 5, a lot of those nice doctors that come into your room and they talk to you so nice, they're so sweet, their bedside manner is amazing, is absolute trash to those nurses. They speak to them any kind of way. They give them a hard time. Nurses have to call back to back to get orders for you. They have to track them down to get pain medicine for you. They do not treat the nurses and other staff members the same way that they treat you. They may be amazing to you, but they are horrible sometimes to the nurses and other staff members. And that is a character flaw, and it is horrible. And a lot of you doctors need to get that together, because nurses are actually the ones who keep your patients alive. Remember that. Number 6, and this one really gets under my skin. Hospitals are filthy. Filthy. And I don't care how much someone says they've cleaned a room. I don't care how much you may smell some antibacterial freshener in the air. Hospitals are filthy. And when I say they're filthy, they're filthy. You cannot imagine the things that happen in these rooms. The amount of bodily fluids and feces and blood that are in these rooms, on these beds. When I say it's filthy, it's filthy. A hospital is not somewhere you want to be for fun. It is gross. And it is also not somewhere that you should bring small little family members if you can help it. And by all means, it is not somewhere you want to walk around with no shoes on. It is disgusting. I have seen people allow little babies, tiny little babies, 1 and under, crawl around on a hospital floor, and I cringe and tell them, please get that baby up. I have seen people walk up and down the halls with no shoes on. That is gross. Hospitals are filthy. Filthy. There is no way in my mind, and I have seen people clean rooms, there is no way they can clean those rooms properly to get all of that bodily fluid, blood, and feces out of that room. Don't do it. Make sure you have on socks, honey. If anything, have someone bring you some wipes. Wipe everything down yourself, because it is disgusting. Number 7, the nurse that you have, you will never know if she's a new nurse. You will never know. Because anytime you ask a nurse, have you been doing this a long time? She's going to say, oh, I've been doing this forever. Why? Because in clinical, when they train on dummies most of the time. Every clinical instructor I ever had said, if somebody asks you how long you've been doing this, have you ever done this before? Say, absolutely, yes, you have. You have done it before. Just not on a human. So you will never know if your nurse, if this is the first time of them trying to get an IV on you, if this is the first time they're inserting a Foley, honey, you will never know, because every nurse is going to tell you, I've done this before. I've done this many times. Number 8, a lot of people feel like nurses are just rolling in dough. They're just rolling in money. And I'm going to tell you, the amount of money that nurses make, especially bedside nurses, does not equate to the type of work and stress that is put on them. People truly do not understand how much stress nurses are under, how understaffed these hospitals are, and how overworked nurses are. They do not understand how much nurses truly go through, how many patients they truly have to see, how many lives are truly in their hands. And this is not to say that there are not some bad nurses out here, because in every field there's going to be someone who is not so great. But I am telling you, your nurse is probably 99% of the time completely overworked and not paid enough for the amount of work she puts in, the amount of compassion that they have to show, the amount of, just stress that is placed on them every single day. Number 9 kind of coincides with what I just said. A lot of people feel when they see a nurse sitting down, she's doing nothing. So many family members will come up to the desk. They're just sitting around. They're not doing anything. I guarantee you, your nurse is doing something. If your nurse is sitting down, it is guaranteed that your nurse is charting. And charting is a major part of nursing. You have to document every single thing to save your own behind, because that's how it works. So even if she is or he is sitting down, they are very busy. I promise you. I do not personally know of any nurses who are sitting around doing online shopping and playing games when they're just sitting down at a nurse's station. Almost every single nurse I have ever worked with, that I have ever seen, they are charting. They are charting. They are sitting at that computer. They are charting. They are trying to get orders for you. They're trying to get their orders put in. They're trying to contact a doctor. They're trying to document something that probably happened 3 hours ago, because they're just now getting a chance to get it done. Nurses are busy. Even when you don't think they are busy, they are busy. Just because they're sitting down, they could be sitting down charting, and honey, they probably haven't used the bathroom in 6 hours, because they rarely get to go. They're sitting there, they're still working. Your nurse is always working. And number 10, you know how some people get very upset and they want the highest person available in the hospital to come and talk to them? You're wasting your time, and I'm going to tell you why. Because most of the higher ups, like your chief nursing officers, your directors, your nurse managers, your house supervisors, they have no idea what the hell you're talking about. And I mean at all. They don't know anything about healthcare. Even though they possibly were a nurse 40 years ago, They really aren't a nurse. They have no idea what is going on. They could not save your life if they had to. They have no